In December 2019, in Wuhan, China, a new virus appears, and it was highly contagious and rapidly spread all over the world, creating a pandemic. Hi, my name is Diana Bermejo, and this is my educational information. Coronavirus is a large group of viruses that has a lipid envelope and a genetic material. It is surrounded by protein and spikes looks that make it look like a crown. Crown in Latin means corona. This is why it has a name. Coronavirus can cause different types of illness in animals and humans. In humans, it can cause a respiratory disease. This can go from a common cold to the most severe disease. These include severe acute respiratory syndrome or COVID, first identified in China in 2003. The Middle East respiratory syndrome or coronavirus, the first was identified in Saudi Arabia in 2012. And SARS-CoV-2 that was reported in China in 2019. So how do these viruses come from? Well, this knows they circulate in a range of animals, but sometimes can jump to humans. This is called spillover, and is due to a range of factors like mutation or direct contact between animals and humans. For example, MERS-CoV is known to come from camels, but the animal reservoir for a new coronavirus is not known yet. How is the disease spread? But the disease is caused by a virus spreading droplets from the mouth and nose when you cough, breathe, speak, or sing. Also, by having close contact with someone with COVID-19 and breathing in droplets exhaling by them. Also, touching contaminated surface and then touching your face. Symptoms. This is an incubation period. It is a time when the person gets exposure from the virus and develops some symptoms. Then average can be 5 to 6 days or it can be ranged from 1 to 14 days. The symptoms can be very mild to severe, or some may not have symptoms at all. The common symptoms are fatigue, fever, or respiratory symptoms such as cough, sore throat, or shortness of breath. Some people report the loss of taste and smell and skin rash. About 80% of the cases recover without needing any special treatment, but it's a group of risk, such as older people, people with chronic respiratory disease, obesity, or diabetes. Also, people with heart disease, high blood pressure, or cancer. How to know if a person gets infected? The best ways to know if a person is getting infected is to get a test. So the best way is just to contact your healthcare provider. You may also visit your state or local health department's website to look for one. Your healthcare provider may use a lung swab to collect mucus from your nose or throat. The infection is usually tested by a diagnosis called reverse transcriptase polymerase chain reactions or PCR. So, what is the treatment for COVID-19? Well, first is supportive care and medicines are under investigation. How to prevent getting sick? Well, the most important thing is wash your hands for at least 20 seconds. Use a face mask to cover your nose and your mouth to prevent other people getting sick. Avoid close contact with people and keep a distance at least 6 feet apart. The statistics shows in the worldwide cases of coronavirus is 58.7 million, with 37.5 million people recovered and 1.39 million deaths. Just in the United States by November 22nd is 12.3 million total cases and 257,000 people dead. If you're looking for more information about COVID-19, you can visit the CDC website. For coronavirus updates, you can visit coronavirus.gov. Also, you can visit the FDA if you want to know about the vaccine. And yes, this is me. helping at the COVID testing center, so please stay safe and thanks for watching.